Carpal tunnel syndrome is a lack of sensation due to a compression at the wrist. What happens is some people have a disease that causes inflammation in the wrist, an injury that causes inflammation or lack of space in the wrist, and that causes compression of the medial nerve. That causes numbness and tingling in these three fingers, and sometimes half of this one. It's something that can be treated surgically or with physical therapy. Carpal tunnel syndrome can be caused by a number of items, mostly repetitive use, especially people that use gaming systems, computers, texting, using the telephone too much. All of those things can cause that repetitive use. Construction workers are especially at risk, using hammers and machinery that would vibrate violently, like a jackhammer, things like that, would definitely set someone up for carpal tunnel syndrome.
People that use their hands constantly for a living, i.e. Secretarial, heavy manual laborers, but it can occur in anyone at any time. Also, there's a subpopulation of pregnant women that can develop carpal tunnel syndrome, which usually resolves after pregnancy.
Carpal tunnel is diagnosed primarily by the symptoms the patient has. They'll normally complain of numbness and tingling in the hands and all the fingers, and the definitive test for it is a test called an EMG. It's an electrical test that checks how fast the nerve is moving and if there's any delay in its transmission of function. The initial treatment normally is anti-inflammatory medications for carpal tunnel. The other treatments are splints. Frequently there will be splints that prevent you from moving your hands, either flexing or extending them. Normally they're worn at night. A lot of times that'll alleviate most of the symptoms of carpal tunnel. But the long-term treatment that's only been proven to be effective is surgical decompression of the nerve.
One way to prevent carpal tunnel syndrome is to not use the hand for any continuous, strenuous length of time, or to take frequent breaks with regards to use of the hand.